Okay, next we will talk about loop or high ceiling diuretics. So we have bumetanide, furosemide and torsemide, and also the one that is rarely used, which is ethacrylic acid. All of these have their major diuretic action on the ascending limb, okay, on the thick ascending limb of the loop of Henle. So these drugs have the highest efficacy in moving sodium and also chloride from the body. Okay, so among the diuretics, the loop diuretics have the highest effectiveness in moving sodium and chloride from the body. So one might ask, what's the difference between efficacy and effectiveness? So efficacy is talking about the effectiveness in a clinical study, in a control situation, whereas effectiveness is in the real world, okay, in the real world and not in a controlled or lab kind of situation. So loop diuretics will cause increased amounts of urine, and among the loop diuretics, furosemide or furosemide is the most commonly used. Okay. In terms of potency, bumetanide and torsemide are much more potent than furosemide. And we tend not to use ethacrylic acid because of its adverse effect profile. So the thick ascending loop of Henle, so this is where we will have the loop diuretics acting upon. So this is an example of an injection of the furosemide. So this is an ampule of furosemide. So bumetanide, furosemide, torsemide and ethacrylic acid. So the mechanism of action. So loop diuretics inhibit the co-transport of sodium, potassium to chloride in the luminal membrane. Okay, in the luminal membrane, in the ascending limb of the loop of Henle. So this causes reduction in the reabsorption of these ions, sodium, potassium and chloride. Okay, so there is less reabsorption of sodium, potassium and chloride. So among all the diuretic drugs, loop diuretics have the greatest, it has the most paramount, most significant diuretic effect, since that the ascending limb, okay, accounts for reabsorption of 25 to 30% of filtered sodium chloride, and the sites later on, okay, the ones downstream after the loop of Henle, they are unable to compensate for the increase in the sodium load. So what are the actions of loop diuretics? So loop diuretics tend to act quickly even in patients with diminished renal function, or even those with slow response to other diuretics. So that's one notable thing, thing about the loop diuretics. So one thing different from thiazides, one of the different different points from thiazide is that loop diuretics increase the calcium content of urine. Okay, so we know that the thiazides will reduce the content of urine, but loop diuretics has the opposite effect. It increases the calcium content of urine. In patients with normal serum calcium concentrations, hypocalcemia does not result because calcium is reabsorbed in the distal convoluted tubule. The loop diuretics may increase the renal blood flow by increasing the prostaglandin synthesis. Okay, and we know that NSAIDs can inhibit renal prostaglandin synthesis, as we mentioned previously. So when we have reduction in renal prostaglandin, and when you have less prostaglandin produced by the kidney, this can lead to reduction in the diuretic action of the loop diuretics, okay, like furosemide. what are the therapeutic uses of loop diuretics? So it's a drug of choice for reducing acute pulmonary edema, okay, and also acute or chronic peripheral edema due to heart failure or renal impairment, okay. So it's mainly to do with edema. That's when we use loop diuretics. It has a rapid onset of action, and loop diuretics are also useful in the treatment of hypercalcemia, as they stimulate the tubular calcium excretion, okay, so it promotes excretion of calcium through the urine. And also loop diuretics are helpful in the treatment of hyperkalemia because it excretes potassium. So pharmacokinetics, it's given orally or parenterally. The duration of action is about 2 to 4 hours, and this enables patient to expect the window of diuresis, okay. So it gives a patient a little bit of ease, okay, in terms of planning their lives. And loop diuretics will be secreted into urine, okay. So what are the adverse effects of loop diuretics? Number one is ototoxicity. Okay, it might cause a reversible or permanent hearing loss, especially when we use it together with the other ototoxic drugs. Example, the aminoglycoside antibiotics, okay, like gentamicin, amikacin, all that. And ethacrynic acid is the most likely to cause deafness, okay, so that's why we tend not to use this drug. Hypouricemia, furosemide and ethacrynic acid compete with uric acid for the renal secretory system, and so it will prevent its secretion, okay, it will prevent the secretion of hypouricemia into the urine tubule, okay, so that will cause or exacerbate the attack of gout, okay, just like if you still remember, in furosemide. Okay, acute hypovolemia, that's another problem with loop diuretics potentially. So because the loop diuretics like furosemide can cause a severe and rapid reduction in blood volume, which may potentially lead to hypotension, okay, blood pressure goes down, shock, okay, hypovolemic shock, and also arrhythmias, abnormal rhythm of the heart. Fourthly, we have an issue with potassium depletion, okay, potassium depletion. So we have reduced in potassium. So this is similar to the thiazides, okay, thiazide diuretics. So the high levels of sodium passing through the collecting tubule, so that will cause an increase in exchange of tubular sodium for potassium, okay. So we have a lot of sodium in the tubule going out towards in the urine, okay. So if you have a lot of sodium there, it will exchange with potassium, okay. So sodium will be reabsorbed, and potassium will be excreted, okay. So that might lead to hypokalemia because a lot of potassium is moving out of the capillaries from the blood towards the tubule, okay, going out in the urine. So potassium loss from the cells in exchange for hydrogen, okay, might lead to hypokalemic alkalosis, okay, hypokalemic alkalosis, okay, we have an alkalosis. And use of potassium sparing diuretics or potassium supplementation may prevent the development of hypokalemia, okay, this is quite logical. Next is hypomagnesemia. So prolonged use of the loop diuretics like furosemide, and together with low dietary intake of magnesium in the elderly especially, can lead to hypomagnesemia, okay. So next we will talk about potassium sparing diuretics, okay, in the next presentation.